Hi, I'm Madison Cox. I'm going to be doing the Med Pass. Here is my ID badge, and let me do my 360 room scan real quick. Don't mind the clothes. All right, and then I'm going to show my desk here. So here's my desk, here's my AccuDose, my little fake scanner, and then my EMR, and then my EMR. All that. Okay. So first thing I'm going to do is I'm going to go into the med room, and I'm going to go ahead and I'm going to log onto my EMR. So I have my EMR here in front of me. So I would go ahead and I would choose my patient to do to see that there is an medication administration record. So I'd go ahead, and then the next thing that I would do is I'd go over my orders. So I'm going to make sure for my orders that I have, obviously, like the correct patient, but I'm going to make sure that I have the correct time on here. I'm going to make sure that, my time here is 11 o'clock. I'm going to say that it's 11 o'clock right now. If it was 9 o'clock, that'd be fine. And if it was 12 o'clock, that'd be fine, because it's okay for an hour before and an hour ahead. Just as long as you're in that 2-hour window. So my time is correct. I have the correct, oops, my timer thing went off. I have my correct date. So the date today is correct for the administration that I need to do. And then I also have the correct medication here. I've got it laid out in front of me. So I have the correct medication, and then I would obviously look at my allergies. So my patient here is allergic to sulfa. Michael is allergic to sulfa. So I would go over that. And the next thing that I would go ahead and do now is I'd go over any nursing implications. So it does say on my EMR the nursing implications for furosemide, which is the medication that I went ahead and I chose. I don't have any nursing implications, but a nursing implication, for an example, would be like to go ahead and check the blood pressure before administering the medication, go ahead and check the heart rate before administering the medication. For example, the metoprolol or the digoxin is check heart rate before administration and hold if apical pulse is below 60. So that would be an example of a nursing implication. I don't have one for my medication, so I would go ahead and I would go on. So I don't have any nursing implications. So now that I know that I have the right patient right now, I've got the time, I reviewed my orders, I'm going to go ahead now, I'm going to log into my AccuDose. So I have my AccuDose kind of sitting up here. I taped it to the wall. So I have my AccuDose, and I would go ahead and I would refer to them. I might just take it off. So I would refer to them side by side here. Side by side, and then I would go ahead here. And now that I've logged into my AccuDose, I would go ahead and make sure that I have my right patient. I see that I have my right medications on here. And I'm going to go over my 6 rates now that I have everything, and I have a side-by-side screen view that I can go ahead and check. It's very important with medications to check over as much as you can because errors do happen. So now I'm going to go ahead and I will go over my 6 rates. So I'm going to go over my rate patient. So I've got Michael here, and it does confirm with the AccuDose. The MRN also does confirm with the AccuDose, and then I do have the date of birth 4/24/1944 that matches with the AccuDose and the EMR. So I have that. Obviously the allergies I looked at, allergy sulfa on my EMR matches with the allergy list here listed in the AccuDose. Then I'm going to go on to the second one, being right medication. So I went ahead and I have furosemide here, and I see that I need 80 milligram tablets here, and on here it's furosemide 40 milligram tablets is what the actual tablets come in the medication. So that would be something that I would have to do calculations for. So then that would bring me to right dose. So my right dose here, what my patient calls for is having 80 milligrams of furosemide. in the actual medication bottle, there are tabs that are only for 40 milligrams. So I'm gonna need one more tab that was ordered, since I need 80 milligrams of furosemide, and I have 40 milligrams of furosemide. 40 plus 40 is 80, they're in milligrams, so I can go ahead and just have 2 tablets, one tablet being 40, another tablet being 40 milligrams, 80 milligrams of furosemide, so I would need 2 tablets there. And then the next thing that I would go ahead and I would do is I would go ahead and make sure that my order route is correct. So my order calls for my medication furosemide being administered orally. The AccuDose tells me that it is in the form of a tablet, and tablets can be administered orally. So I would go ahead and administer my furosemide orally to my patient. The next thing I would go ahead and I would do is I would check the time here, and like I said last time, it's 11 o'clock here, and it does say that it's 11 o'clock on here. If it was 9 or if it was 10 o'clock, 12 o'clock, that'd be fine, as long as it's in the 2-hour window. So that matches up on both screens. So then I would go ahead and I'd go over right documentation, but I'm in the med room and I don't have my patient with me, and I didn't see them take any medication, so I'm not going to document that until I do. So now, after I went over all of that, I'm going to go ahead and I'm going to log out of my EMR. Or I'm not going to log out of my EMR. I'm going to dispense the medication. So I'm going to dispense my medication, and I pulled it out here. So I have my medication, and I put my fake medication in this cup. But here's my medication. I'm going to go ahead and I'm going to check here that this name of the medication matches up on my AccuDose form. And it does. So it's the right medication. It has the right dosage here, 40 milligrams. And then the expiration date here on my furosemide is 12/22, and it's currently 2021. So we're fine, and the bottle is intact. So now I'm going to go ahead and log out of the EMR and the AccuDose. Reasons being just for HIPAA. You don't want anybody to come by and see things that your patient doesn't want out there. So log out of everything, make sure everything's logged out of, and then now that everything's logged out of, I can grab any supplies that I need. Like if I need it to be taken with water, if I need it to be taken with food, I would grab that. So now I'm going to go ahead and I'm going to grab everything I need, and I'm going to go into my patient's room. So I'm going to walk in my patient's room. And I have my patient here. I'm just going to sit so that you can kind of see a little better. So I have my patient's armband. So I'm going to go ahead and I'm going to wash my hands. I'm going to introduce myself. Hi, my name is Madison Cox. I am a student nurse today, and I'm going to be administering furosemide to you. And then I would answer any questions that they had. I would go ahead and ask them to identify their name and their date of birth, and then I would also look at their allergies, and I would confirm that with their armband. I would explain that furosemide is going to be a diuretic medication, and that it is used for controlling the high blood pressure, heart failure, and edema. So I would go ahead and I would make sure that my patient knows everything to do with that. So now that my patient has the education, I'm going to go ahead and now I'm going to log onto the EMR in the patient's room. So go ahead and log into the EMR, and I'm going to go ahead and so now that I've logged into the EMR in the patient's room, I'm going to go ahead and I'm going to take my fake scanner, and I'm just going to bring my patient over here. I'm going to scan their little badge, and then I'm going to make sure that, again, I'm going to go over that the furosemide matches on with their badge, their allergies. I'm going to make sure that their allergies, it says sulfa on their badge here. I don't know if you can see, it says sulfa on their badge. So I'm going to go ahead and check. It says sulfa here on the EMR. I went over that, and then now I'm going to go ahead. And I'm going to go ahead and I'm going to select my admin here. And I'm going to, what do I do after that? I'm going to go ahead and I'm going to scan my medication. I'm going to make sure that everything comes up again, furosemide, 40 milligrams, and then the date is correct. And then after that, I'm going to go ahead and I'm going to put in the amount of tabs that I need. So I need 2 tabs. Again, because, it calls for 80 milligrams. Furosemide is only in 40 milligrams. So I would go ahead and I would do that. And then I'm going to go ahead and I'm going to scan my badge another time, just because I need to scan the badge prior to having anything administered to my patient. So now, since I went ahead and I've scanned my badge 2 times, I've went ahead and I've scanned my medication. I'm going to go ahead and I'm going to pour my medication out. But before I did any of that, I walked into the room and I went to my patient's correct bedside. That is very important. So I went ahead and I went to my patient's correct bedside, logged into the EMR like I just did, scanned my medication, scanned my patient's badges, looked over allergies. I did everything I need to do. So now the last thing that I'm going to do is I'm going to go over the 6 rights one more time. So I got my EMR pulled up. I've got my patient right here. I've got his arm bands. I'm going to go ahead and I'm going to have my patient confirm again his name, his date of birth. I'm going to look here, Michael, date of birth 4/24/1944. That matches here with his armband. So now, since it matches with his armband and I've looked at the allergies that also match, I'm going to go ahead and do right medication. I've got my bottle of medication here. The name matches identically with the name that I have in my EMR. So I've got the correct medication. I'm going to go ahead and make sure I have the correct dosage. I made sure I had 2 tablets that I chose. So since I had 2 tablets, because my medication calls for 80 milligrams, it's only 40, like I said again, I'm going to need 2 tablets. So I've got 2 tablets for my dose. My order calls for my furosemide to be administered orally. In my AccuDose, it told me that it is in the form of a tab. Tabs can be administered orally, so I'm going to go ahead and administer my medication orally. So now, since I've got that, I'm going to go ahead and lastly check the time. It's 11 o'clock. I could have administered it around 10 or around 12. As long as I'm in that 2-hour period, I'm good to go. It's 11 o'clock. I'm great. I would also make sure that my documentation is the last thing that I do when I watch my patient take the medication. So I'm just going to do this here. So I would make sure my patient is in an upright position. I've got everything here. Upright position, I'd go ahead and administer my medication here. And if I had to touch the medication, I would have gloves on, but you try to not touch the medication. I'd watch my patient take their medication, swallow it. I'd watch that. And now I'm going to go ahead and I'm going to go ahead and I'm going to document if my patient took the medication or if my patient didn't take the medication. If the patient took the medication, I would say my patient took the 2 tabs of furosemide, equaling 80 milligrams, because they're both 40 milligrams. So I'd go ahead and I would document that with the right time, the right medication, the right dosage. I'd notify, I put it in my EMR. And then I'm going to go ahead and after that, I'm going to confirm that I have the right time and the right documentation that I administered for my med pass. So I make sure that everything I have is documented correctly and that the time lined up, my patient took the medication. If my patient did not take the medication, I would obviously educate them and tell them why it would be, beneficial for them. And let's say they went ahead and denied again, I would let the physician know and I would document the reasons why. So now, since I did everything, we went over the 6 rights before administering the medication. My patient took the medication. I made sure that I documented the right time and documentation for the med pass. So I went ahead and I did that. I documented everything correctly. If they took it, if they didn't take it, I watched them. Now we're good. Log out of my EMR. Logged out. Obviously for HIPAA reasons, like I mentioned again, I'm now going to position my patient for comfort here, as if this is like a bed. Position my patient for comfort. Side rails up by 2. Call light in reach. Items in reach. Making sure that they're feeling okay. Obviously, I'm going to make sure that the bed is in the lowest position and that everything that they have is in need. So, we're all good.